There we go. People will start coming in. There we go. Welcome, everybody. We still have 2 minutes before we get started. If you'd like to type in the chat box where you're located, that would be very helpful for me and the speaker. Just your name and where you're located. If you are a University of Kentucky extension agent, you must sign in with your name and county so that I know that you are here. You will then have to sign out again at the end so that I know you stayed the whole time. Well, Washington. We get quite a few from Washington. We get very few from California. Maryland. Cool. Welcome. We still have 1 more minute to go. Again, if you are a county agent with University of Kentucky, you need to put your name and county so that I can verify that you are here the whole time. More Maryland, another Kentucky person. Okay, I have 3 o'clock, so we're going to get started. We'll do the basic introduction as other people come in. My name's Dr. Jackie Jacob, and I am an extension specialist at the University of Kentucky. And as part of my position, I coordinate the small and backyard flocks community of practice on e-extension, which is the electronic version of the National Cooperative Extension Service. And again, it specializes in working with small and backyard flocks. As part of that, we have a website, Facebook page, and we do these monthly webinars. They are all recorded, and the recordings are available on our YouTube channel. And when they're ready, that's posted on our Facebook page, as well as the page in which you registered for the program. We have one every month, usually the first Tuesday of the month. February, I think we do it twice because it is in English on Tuesday and Spanish on Thursday. It's a Spanish speaker, so we got lucky with that one to do it twice. Okay, so today's presentation, Geoffrey, you want to put up your PowerPoint?
Yes.
Is
good afternoon. Sorry.
I was going to introduce you, but I can let you do that. Just that you're from.
Yeah. No. Oh no. Sorry. Feel
You're
free
our
while I
speaker
get
for today on chicken health and well-being, and Dr. Geoffrey Lossie, a DVM, correct, is going to give the presentation. While he is presenting, I will be on mute. I will be monitoring the chat box and the Q&A box. If you have a question, please type it, because if you're like me, you forget the question if you don't put it in right away. If it is pertinent to what he is talking about at the time, I will pop up, my video will come back up, and I will interrupt to get that clarification. Otherwise, we will hold all questions to the end. So again, if you could put where you're located in the chat box, that would be appreciated. And if you are from the University of Kentucky and a county agent, in order to get credit for being here, you must prove you were here the entire time. So you must put your name and county in the chat box. So it's all yours, Geoffrey, and I will go on mute and let you take over.
All right, thank you so much, Dr. Jacob. Yes, my name is Dr. Geoffrey Lossie. I'm an avian diagnostician here at the Indiana Animal Disease Diagnostic Lab, and I also have an appointment as a clinical assistant professor here at the Purdue College of Vet Med. So today we're going to be taking roughly about 50 minutes to talk about chicken health and well-being. And what I'm going to focus on today is a little bit different in terms of how you might have learned chicken health and well-being before. And I'm going to come at some of this presentation more from a diagnostician standpoint. And so hopefully this will be a little bit more, even if you've had similar topics, this hopefully will be a unique view for you on some of the challenges that small flock or backyard flock owners face with rearing chickens. So the first thing that I want to really harp on is knowing normal. This is so fundamental to animal husbandry of any type. But I have often found that with poultry specifically, this is can be a challenge for quite a number of owners. And the main reason for that is in my experience, a lot of poultry owners that I work with are first-time owners, and they don't have years and years of experience raising and being around poultry, and they have no concept of what normal is for these birds. And so how do you get to know what is normal? How do you understand normal? Because before you can understand abnormal or states of disease, again, you need to know what's normal. Well, one of the best ways to do that is a physical exam. And I'm not going to run through and take the time to present how to do every step of a physical exam. But what I am going to point out is kind of how to create a systemic approach and how to do things in order. So when I'm examining a bird, for example, if I go out to a flock and see there's 10 birds and I identify two that are acting off, the first thing I'm going to do is a physical exam. I'm going to do it the same way every single time. If you create a systematic approach, for example, myself, I always start at the head, work my way down the bird's body, and end with examining the feet. So head to feet or front to back is how I do my physical exams. And as long as you do it the same exact way every single time, your chances of missing things go down markedly. So what are some key areas to examine? And we're going to play a little game here called shortly called normal versus abnormal. And what we are looking at here are certain key areas on a bird that are either typically diseased or give indications of disease. We'll certainly be talking about the eyes, the nares, so the opening to the nostrils, or the nostrils themselves, the oral cavity, the comb, all these different parts are things that I look at during a physical exam. Now, one of the things you might be asking yourself is, do I need to listen to the lungs? Because, oftentimes we think, okay, physical exam, I go to the doctor and get one, my dog and cat get one from the vet, and the vet always listens with a stethoscope, right? And so that is what auscultation is. When they put on the stethoscope and they listen to the lungs and they listen to the heart. In my experience with poultry, if there's a respiratory problem, you will either see evidence of it or you will hear it before you need to ever use a stethoscope on a bird. Restraint depends entirely on the species that you are working with. The only thing I'll say regarding this quickly is that in order to handle birds safely, and when I say safely, I mean, especially with chickens, I'm referring mostly to not injuring the animal versus the animal injuring you. But the most important thing is to control the legs and the wings and always support the keel, which is the breastbone as well. If you control the legs, by and large, you control that bird. So controlling the legs is the most important thing to really control on a bird during a physical exam. So we talked about what's normal, or we're kind of getting into that concept. One of the things that if you're trying to help a friend diagnose a disease problem, or if you think, hey, I might have a disease issue, this is something that I teach vet students, obviously, is part of getting a good history. But even if the birds are your own, which I imagine many of the people in this call either have their own birds or they're extension agents. And so these are going to be really key questions when you either are working up a potential disease in your flock or somebody is calling you looking for advice. And so we'll take a second before we start looking at, side by side, normal, abnormal of the important body systems. There are a few really key questions that I want to point out to everybody. And the first one is number one, and it is, have they added new birds recently? I cannot express the number of times that I've taken calls from members of the public. I have taken calls from all walks of life, new chicken owners, experienced chicken owners, and they are describing to me a new developing disease of some type in their flock. And I ask them, have they added new birds? 9 times out of 10, the answer is yes. The single riskiest thing a person can do to introduce disease to their flock is to add new birds, especially if we're talking about birds from auction houses or public, livestock auctions, birds coming from exhibition shows. From a pure diagnostician standpoint, somebody that's concerned about disease, exhibition poultry is very difficult to manage disease in because these birds travel nationally. They're all in relatively confined spaces. They are stressed. Their immune system goes down. And so adding new birds, taking birds to show, coming back, almost inevitably somebody will say, yes, I did just add some new birds. You also want to ask, how did they acquire their birds? Again, did they get it from a neighbor down the street? That's a super common one. Hey, my neighbor moved down the street and they asked if I could take their chickens for them. And I said, yes. And now, I'm seeing signs of XYZ disease. It's also extremely important in determining Merrick's vaccination status. So Merrick's disease is by far the most common disease that I encounter working with folks that have small flock or backyard poultry. And the reason a lot of times, at least in my experience, that it's so rampant is that most of your birds, if not all, it does, from what I understand, depend on the store potentially, but they're getting their birds from largely large kind of agricultural big box stores. And these large agricultural, stores, they do not provide birds that are vaccinated for Merrick's. So if you are getting birds from a rural or kind of farm supply store, you can almost guarantee that they're not vaccinated for Merrick's. But that's, if you don't know where your birds are coming from or where you acquire them, you won't know the vaccination status. The age of the birds affected and the age of birds in the flock. This is important because, again, the main disease that I deal with is Merrick's disease, and I'm giving a little bit of a spoiler, but for those of you taking notes, the most common age that you will see Merrick's manifest as a disease in poultry, in chickens, is between 2 to 9 months of age. So automatically, if I'm talking to a client on the phone and before I've even asked any of my other questions and they say, the birds are between, my birds are 5 months old. The first thing that pops into my head when I hear that is Merrick's disease. Another big important one is, what are they feeding? What makes up the majority of the diet? I've had a lot of clients feed birds free range, and they thought the birds could survive on everything that was in the pasture. So I've seen birds starve because they were not given any supplemental feed. I've seen people where the majority of their diet is coming from treats, or it's coming from table scraps, and it's not a fully formed, nutritionally complete pellet, which is what I always recommend. And other things to keep in mind if you are trying to help someone with figuring out what disease might be going on, or if you're going to be the one providing history to a veterinarian or that extension specialist. Big questions to ask is, how long has the problem occurred? So, and again, this should be very similar to questions that your veterinarian will ask you for your dog or cat, or your medical doctor if you're talking to them. What signs are they seeing? What is the level of mortality? So the number of birds that have died potentially due to this illness event. And what is the morbidity? And morbidity is a term that describes the percentage of animals in a group that are exhibiting clinical signs. So let's say your clinical sign is sneezing, and half of the birds in a flock are sneezing, so your morbidity would be 50%. And if one died, your mortality would be 1/50th, or 1 out of 50, converted to a percent. Another big important one is, have they treated the birds with anything yet? Oftentimes, one of the other big ones that we deal with are mycoplasma species. So this is an upper respiratory bacteria. There's 2 different species. And often, if the owners have treated the birds with antibiotics, it can sometimes be difficult to get a diagnosis depending on the sampling method that you're looking at, or that your veterinarian will be looking at. Okay, so now, I've mentioned the importance of normal. We've talked about either providing an excellent history and giving a good history, but now let's look at some pictures, and let's kind of go through and really get a good sense of what's normal and what is abnormal. So we have here, first thing is a bird on the left. You can see it's at a poultry exhibit show. But when you look at this bird, it has a nice erect comb, sharp points to the spike, or to the spikes on that comb. Really nice dark red coloration, nice long wattle, helping us know that this is a male along with the comb. And then we have the bird to the right. Look. Now, again, this is most likely a hen, so comparing a hen to a rooster is not necessarily fair when looking at the comb and wattles. But hopefully you can appreciate how shriveled this comb is compared to a normal healthy bird on the left. And when you see that really pale, it's almost taking on a bit of a blue hint, or pale kind of a white hint to it. That's a really easy, clear indication that there is something going on in this bird. It doesn't help you, seeing a comb and wattle like this, it can tell you dehydration, but that's really about as specific as you can get. This is a good sign, though, to know, because it'll be easier to catch those birds, hopefully, earlier in the state of the disease process, where something can actually be done to treat or amend what disease might be going on. So this is an example of fowl pox. And so what I'm showing you here are examples of pox or pox takes all over the comb of a chicken here. And so again, knowing normal, nice bright red lesion-free comb compared to this that has all of these dark raised circular black to brown scabs. And so if somebody is describing these to you on the comb of their bird, particularly in the fall or even early winter, that's when I typically encounter pox cases in backyard flocks. What's something else that we encounter frequently here in the Midwest of the United States? Maybe not so much this year with our relatively warm winter so far, but that is frostbite. And so here we've got a picture of a chicken, and you can see there is a sharp, what we call a line of demarcation between this stark black tissue here and the normal healthy red tissue underneath. Now, this bird is going to lose all of these points to their comb, and it's going to end up being kind of a flat linear comb. This is very common in any time that you have temperatures that are below freezing. You can run into issues with frostbite, but again, helping to know normal versus abnormal. So coloration is very important. When we talk about respiratory disease, and we'll look more at this specifically in terms of what are the most common respiratory disease agents that we generally see, what I try to get my vet students to understand is that in poultry, and of course this includes chickens, the eyes are the window to the respiratory tract. And what I mean by that is if you see any signs of disease, and we'll kind of break down what we're seeing in this image here, but if you see signs of disease that are involving the eye, oftentimes you should be considering that this might be a respiratory disease rather than a primary ocular lesion. So you can see in this bird in the left, we have healthy eyes, so nice, clear, round pupil or iris with a clear pupil with no ragged edges. You can see, look at all the normal feathering around the eye. So all these very fine feathers right along the eye. There's no discharge coming from the nares, from the nostrils. And then we compare it to this bird on the right. And so what you can see here on the right is look at all those fine feathers right around the eye are gone. So that's periocular, so around the eye, feather loss. You can see that the eye here is actually completely encrusted shut due to ocular discharge and matted feathers. And there's also, look at all this swelling, mostly below the eye, but some above the eye as well. And what you're seeing right there beneath the eye, that's a specific anatomic location in birds called the infra or beneath orbital, and being eye, sinus, the infraorbital sinus. And when you see inflammation and a big puffy infraorbital sinus, the first thing that you should be thinking is a respiratory disease. Other things to point out in this bird, you can see some mucus, some mucopurulent or basically pus or mucus-like discharge coming out of the nose. And again, look at this bird's comb. You can see, again, these spikes are kind of shriveled. It's not nearly as healthy as this comb. So again, just kind of when you're examining a bird, you're kind of putting all these clues that you're finding together. This is an example of a bird, in this case a turkey, with some panophthalmitis or an ocular infection due to E. coli. Not every, but it is still probably respiratory related. E. coli is one of the most common, what we call secondary bacteria, or bacteria that love to invade and cause disease after something else has already made the bird sick. It can also be a primary disease and cause illness just by itself. But what I want you to see in this image is, again, all of this periocular crusting. You can see there's periocular feather loss. And look at this white, milky appearance to the cornea. So that's the outer surface of the eye itself. And so this is a bacterial E. coli infection of the entire eye. Whereas if we look at this image, now if we go back one more, so notice on this bird, it's so cloudy, you can't see the iris anymore. You can't make out the iris or the pupil. In this bird, we can still make out the pupil, which is this dark ring here, and we can make out the colored iris, but there's this gray haziness that we can see through there. And what you're actually looking at is a cataract in a bird. And there's actually a disease in poultry called avian encephalomyelitis virus, which can cause cataracts in poultry. It can also be caused by trauma, or it could be caused by aging, but generally I don't see backyard birds getting to the age that I see cataracts. This is another one that you will not likely encounter in your most typical backyard or small flock setup, generally because those coops have such good ventilation in them. But if this is something like a bird in an old repurposed, swine house that has poor ventilation, you could definitely see this. And what I want you to look at is, again, the cornea, or that outer surface of the eye. You can see this white, thin kind of strands, or this membrane across the eye. This is an example of ammonia burn. And so you may have heard of ammonia. It's a gas that's released when poultry manure and lots of other things are broken down by bacteria. And that ammonia, if you've ever scooped out a really stinky or bad cat box that hasn't been scooped in a while, and you get that smell and it kind of hits you in the face and almost makes you cough, that's ammonia. And ammonia can actually burn the surface of the eyes. It can burn the opening or it can burn the trachea. So the lining of the trachea leading to the rest of your respiratory tract. And these birds are often functionally blind as well. Going to a normal structure here that folks may not be aware of, but birds actually have an incomplete hard palate, and that is natural, that is normal, and that is of all birds. And so you can see this slit here in the roof of the mouth. That's normal, and this is called the choanal cleft. And so that is a direct communication from the nasal sinuses, or the nasal cavity, to the oral cavity, which is why that choanal cleft is the most frequently sampled place. You can stick a swab and roll it gently in between that choanal cleft, and that picks up all the respiratory secretions. And so that, for us veterinarians, that is a great place to sample for respiratory diseases. Particularly a hot button topic right now is avian influenza. But do note that the rest of the oral cavity is nice and clear with a healthy pink mucus lining. Then there's something like this, oral plaques, or which are often fungal in nature, can form in a bird's mouth. And so the oral exam, or at least opening the mouth and examining around the tongue and that choanal cleft, is another important part of your physical exam and knowing normal. So this here is a large fungal mat, what appears to be a large fungal mat, in the bottom of this bird's mouth. You can see the tongue here, and then you can see a little bit of the choanal cleft here. Now, one of the other things that I commonly have owners be shocked is when I tell them after I've done a necropsy, which is kind of the veterinary term for an animal autopsy. They're often shocked when I tell them your birds are extremely thin. And especially first-time bird owners, a bird is all feathers. It's very difficult, I completely understand, to look at a bird and oftentimes tell if it's thin or not. And so instead of trying to visually examine these birds to check their body weight or what we call their body condition, instead it's much more applicable to actually palpate the breast muscles on either side of the keel. And so that's what I'm showing in this image are my gloved hands kind of palpating the amount of muscle on either side of that keel. And teaching a flock owner how to do this, knowing how to do this as a veterinarian is extremely important in terms of providing me information on an individual bird, but also doing this on a flock-wide basis is extremely important. For example, if you just get one bird brought to a vet and it's really skinny, that could be an individual bird issue, or it could be a flock-wide issue. And which is another point where if you're ever examining birds or examine as many birds as you can get your hands on, essentially, in order to learn your normals and get experience. This is showing a body condition scoring system. So some of you in the extension ag world might be familiar with body scoring of cattle or other food producing animals. Well, we do the same thing with birds. And so this is kind of a 3D cross section through the keel. And so that keel is that very prominent projection off the breastbone. And this is for laying hens. And you can see, 0, there's very little skeletal muscle lining that keel. Whereas if we go all the way to number 3, you can see, if you can follow my pointer, that there is a lot more skeletal muscle or pectoral muscles covering that keel. And so palpating lots of birds and being able to palpate and give a body condition score kind of in just an instant of palpating a bird can give you a lot of good information. And to give you an example of an extremely emaciated bird, here's one. This bird was actually the same bird that I showed you the image with the eye with the ammonia bird. And so this is, you should not really be able to ever see light through the other side of the keel. And so this, if you follow and trace my arrow, this is the tip of the keel bone or the keel process here. And what you're seeing on either side is this scant, pretty much non-existent skeletal muscle. And if you look at the bird in the background, again, you can kind of appreciate how light shining through there. There's almost no skeletal muscle covering that bone. So this is an extremely skinny bird, unfortunately, because it was blind from poor house management and ammonia toxicity. Looking at the feet, as I've mentioned, we're kind of coming down in our physical exam. We're getting to the back of the bird. I look at the feet, and what you want to see are very nice overlapping scales. When you start to see scales that aren't overlapping, and I believe it's the next image, but I might have gotten them mixed, we'll just go ahead and skip down to it. I'll go back real quick and we'll talk about pododermatitis. But I want to bring this image up because it does a really good job showing diseased versus normal scales on a foot of a chicken. And so here on the right, you can see this foot is swollen and it has these kind of flaky, chalky, kind of raised almost growths kind of all along the foot. And if you ever see a chicken foot like that, it is almost 100% diagnostic for what we call scaly leg mite. As the name implies, it causes unsightly scales on the legs. And it is a mite that burrows underneath those scutes or those the scales on the feet, and due to its feeding activity causes this marked inflammation and hyperkeratosis that ends up appearing as scaly leg mite. So I wanted to go back and show, so we have the top of the feet here, nice healthy scales, and always look at the bottom of the feet. If you are going to find a cause of lameness in a bird, I would say over 75% of the time, if you look at the bottom of the feet here, you're probably going to find it, because it's probably going to be a condition known as pododermatitis, which is basically a localized infection of the bottom of the foot. And here are some images. This top left image is a little bit more atypical, so not as common as what you would see. But I like this image because what it's showing is basically a large abscess in between the toes. So you can see there's this prominent swelling here in between those toes, and that's essentially an abscess. And what we have here, these are the foot pads. Obviously, we're not looking at a chicken here. This is a duck. But again, you see these black, large, this fleshy mass. And that, again, is a different kind of manifestation of pododermatitis. Now that you've seen kind of the more abnormal side of pododermatitis, this is your classic pododermatitis. So again, we saw this normal, healthy metatarsal foot pad. You come down here and you can see this black to brown scab and swelling on that metatarsal foot pad. And this is pododermatitis. This, in my experience, alongside Merrick's disease, is the most common cause of lameness issues in backyard flocks, and is often missed by owners until it's pretty severe and causing lameness. This is 100% a husbandry-based disease. There is something not ideal with the perches or the substrate, the weight of the bird, the run. It might, if there's pea gravel or rocks that these birds are constantly on as their substrate for their run, that causes damage and pressure on the bottom of the feet, and it can cause pododermatitis. So very important to look there to find sources of lameness. We already talked about scaly leg mite. One other thing that is difficult to show without having a bird model here or a live bird to demonstrate on is how to palpate if a bird is currently in lay, or I should say is laying eggs. And the easiest way to do that is to palpate with your fingers over the abdomen. So you're not going intracloacally, you're just palpating over the skin of the abdomen. And what you're feeling for are these two pubic bones. And if this is my hand, you're going to kind of rest it on the bird's abdomen, just a little bit north of the vent. And you're going to palpate here until you feel these two kind of pokey protuberances. And those are the pubis, or is the pubis coming off the hip, or the synsacrum, excuse me. And so if you can fit 2 to 3 fingers in between those pubic bones, that is a really good indication that the bird that you are examining is currently laying eggs. One of the biggest complaints that I also have had from clients is, hey, I've got 8 chickens, I'm only getting 7 eggs, somebody's not laying, who is it? How do I find out who it is? This is a very easy way to do that. Showing here a nice, normal, healthy vent of a laying hen. So you can see nice, glistening pink mucosa. The skin right around that vent is nice and healthy. There's no cuts. There's no signs of pecking or any bleeding that would indicate something like cannibalism. This, however, is a little bit of a cloacal prolapse. And so you can see this fleshy, slightly congested pink tissue here. It's a little bit of a cloacal prolapse. Now, one of the things that I'll tell you is that if you are examining a hen, particularly if it is an obese hen, and yes, 100%, chickens, just like almost every other critter, can become obese. When you are handling an obese hen, especially when they're stressed and they're trying to resist your restraint, it can be normal for that cloaca to prolapse slightly. Once you put the bird down, let it relax, go back to normal, that cloaca will usually go back and reduce itself. It becomes an issue when the cloaca is averted outside the vent for a long period of time. And we'll talk more about some reproductive issues and challenges later in this lecture. I didn't want to leave out waterfowl, though. And as always, this goes for any of these photos, I always recommend that you wear gloves. But what you can see in this image is the phallus of a male duck. And so waterfowl, so ducks, geese, swans, anything like that, they are different than our chickens and turkeys in that males have what we call a phallus. And whereas with females, you can get cloacal or oviductal prolapses, the males can have phallus prolapse, in which case you can see this phallus has been prolapsed long enough that it has lost circulation to it. It is what we would call devitalized. And the veterinarian went ahead and amputated that phallus on that duck. So this duck will live a perfectly happy, healthy, normal life. It just won't be able to physically mate. So one of the other things is, unless you see obviously something wrong with the eye or clearly the bird is limping, again, oftentimes birds are masters of hiding any type of sickness or illness. And by the time an owner has noticed something, by the time it gets to me or to you as an extension agent or another veterinarian, whoever you might be, oftentimes the condition has become pretty bad. But there's also just very general signs of illness that don't indicate anything more specific other than, hey, that bird does not feel good. So if the bird becomes lethargic, so lack of energy, it's not bright, alert, and responsive unless it's being handled. If it's not eating, having that characteristic fluffed up appearance. So birds, they'll try to make themselves appear bigger, showing that they're very healthy and that they're definitely not sick, even though they are. We've already talked about dry, shrunken combs as a very good sign of dehydration. And you might see some behavioral changes. These birds might isolate from the flock or not interact with other flock mates, and they might be hiding in odd areas where you've never seen them before. So hopefully I've given you an idea of how important knowing normal is and kind of showing you normal of a few systems versus some abnormal images. There's a lot of text on these slides. I'm not going to read through these, but there are some important things that I want to highlight for each major body system. So the first one that we're going to look at are top respiratory conditions. And again, these are roughly in order, but these are some of the most common things that I see. I do want to point out that number one is Mycoplasma gallisepticum. And also that, I'm sorry, those are reversed. It should be 3 and 4, Mycoplasma synoviae. These are two bacteria that can cause respiratory disease, with Mycoplasma gallisepticum being much more severe. The reason I want to highlight these two mycoplasmas is that mycoplasmas, they are bacteria, but even with antibacterial treatments, you will never cure that bird of that bacteria. meaning it will be a carrier for life. And that has some very big implications on future plans for flocks, as well as just trying to get across to that bird's owner that this is not something that's ever going to be cured. I do want to point out that infectious coryza, this is one where Google can be your friend, best friend, but it can also be an enemy. And this is one where I have had countless owners type into Google, puffy swollen eye, and then a lot of times they'll say bad smell, like a wet dog smell, coming from their bird. Their bird smells strange and has these big puffy eyes. Google will almost always say this is infectious coryza. I'm just pointing this out because in my experience in backyard flocks, it's almost never infectious coryza, and it usually will be Mycoplasma gallisepticum. And if you remember all the way back to the beginning, or if you scroll back in this presentation in the future on YouTube, remember that bird that had that swollen shut eye with the nasal discharge? That bird had Mycoplasma gallisepticum. Let's see, GI differentials. The big one that I want to point out is that oftentimes your number 1 and number 2 differential should be coccidiosis. Coccidia being a single-celled, or what we call protozoal parasite that live within the cells that line the intestines and cause diarrhea. Oftentimes it can be blood tinged, so some bloody diarrhea, and it causes emaciation, water loss, decreased nutrient uptake, and can lead to death as well. But for backyard or small flocks, coccidiosis is my number 1 differential. And differential, sorry, I didn't describe that term. A differential being something that I am thinking is the primary cause of the disease that is being manifested in a bird. So if I see a sick bird with diarrhea, the top differential or cause, you could think of it as, is coccidiosis. Neurologic differentials, the number 1 is Merrick's disease. So if you have a bird with paralysis or paresis, which just means it's not fully paralyzed, so it still has some function, but it's not completely normal, that your top differential has to be Merrick's disease. And this is where, going back to that how to collect a proper history, that is going to help you narrow down on if this could be Merrick's disease. Top differentials for skin lesions, cannibalism, pox, frostbite. Those are probably the most common. Another very commonly seen form of trauma is mating trauma. So when you have a male rooster with intact spurs mount a female, especially if those spurs are not being maintained by the owners, they can cause some pretty significant lacerations on a hen. And so especially during the breeding season, that can be a very common cause of trauma, particularly for hens. Lameness, again, number 1 is pododermatitis. But if you look at the feet, don't see any, and the birds between 2 to 9 months of age, again, think Merrick's. Hopefully, if there's nothing else that you guys have all gotten from this presentation, it's that Merrick's is extremely common and happens between 2 to 9 months of age, most commonly. Now, one of the topics that I was asked to kind of discuss or look at a little bit more are some reproductive conditions of laying hens. And one of the most common ones that I encounter in birds that are older than 2 years of age is a certain syndrome of cancer that we call adenocarcinomatosis. Essentially, what that term means is a wide spreading of metastatic or spreading cancer within the body cavity from a glandular tissue. In this case, it is either a tumor of the oviduct or the ovary or the pancreas. And I have some pictures of birds with adenocarcinomatosis coming up. Egg-bound or internal layers, also common. And again, just going back to what I mentioned previously, by the time most clients contact me as a veterinarian for reproductive issues, often it ends up having a pretty poor prognosis because, again, these birds can mask the fact that they're not, if you're not 100% up on who's laying in your flock, birds can survive for months with some really, really wild, severe lesions related to the reproductive system. And we'll look a little bit more at some of those. But why do birds sometimes become an internal layer? Or why isn't my bird laying? So what are some different things that contribute to reproductive disease? Probably the top 3 are the biggest ones that I see. So nutritional deficiencies or excess. Lack of feeder space is a big one. You might have a 55-gallon drum of feed that technically has the appropriate amount of pounds of feed to feed, let's say, 200 chickens. Let's say your 55-gallon drum has enough feed. What it doesn't take into consideration is the feeder space. So remember, birds in a flock are competitive, and there's the pecking order, and birds that are highest in the pecking order tend to dominate the feeders. So if you don't have enough feeders or feeder line space for the birds on the lower end of the pecking order to get at the feed, you can have, a whole giant feeder full of feed, but actually end up having birds in that flock that aren't getting enough. And if those birds aren't getting enough feed, well, guess what? They're not going to have the nutrients that they need to lay eggs. Another common error is a complete lack of large particle calcium. So this is going to be your crushed limestone or oyster shells. That's your most common. They should always be offered free choice to birds that are of laying age or have already laid an egg. Just as a side note, once you have your chick feed, then you kind of have your pre-lay diet. You can generally switch from a pre-lay ration to a laying ration with large particle calcium at 18 weeks of age or after the first egg. Before that time, let's say, for example, you give too much calcium to a bird that's not sexually mature yet, it can actually cause the bird's reproductive tract to start maturing too fast. And it can go into production and start laying eggs before the bird's skeleton has had time to expand and become an effective part of that egg laying process. So providing excessive amounts of calcium, so for example, feeding a layer ration to birds that are not yet laying, can also cause issues. Obesity is another really common issue in backyard birds, particularly folks feeding mealworms, sunflower seeds, but obesity has a lot to do with lipid dynamics throughout the body, and that has a lot to do with the reproductive tract. Obese birds have difficulty laying eggs. They have oftentimes will have double ovulation, which can lead to double yolked eggs or internal layers. So obesity is not a friend of a laying hen. And then finally, improper male to female ratios. I think it's about time. Unfortunately, I didn't get to some of these images, but what I want to real quick pop out and show you guys, because I think this is a good platform. In terms of reproductive disease, there is a new kid on the block, so to speak, and it is a virus called egg drop syndrome. Egg drop syndrome is a virus, but what I want to show you are the signs. You can get loss of eggshell pigment, You get thin-shelled eggs that might have a rough sandpaper-like texture. You might have soft-shelled or even shellless eggs. So it'll appear as just yolk with an albumin and then a thin membrane, but no actual shell. And it can cause a drop in egg production. And this is in large a commercial production, but we do believe that is out there in backyard flocks as well. So this is from a commercial flock. You can see these are very thin-shelled eggs. They're very rubbery in consistency. And so this is just one thing that if a client calls about rubbery, thin-shelled eggs, egg drop syndrome is something to keep in mind. So I know that was a lot of information. I am more than happy at this time to take any questions that have come up.
We have several questions. One I answered because it was
thank you.
But basically, for those that didn't see the answer, it was looking at confusion of symptoms, and so why would they have Merrick-like symptoms, but if you give vitamins, it solves the problem? And obviously, it was misdiagnosed since it was a vitamin deficiency, and she wanted to know why, if you're feeding a commercially balanced diet, why would you get that? And what I get a lot of is people feeding crack corn and scratch grains and diluting the nutrients and getting the deficiency, or the feed, they buy too much feed at once, the feed is old. So that was that was one of my common questions. But so we get a question about sneezing. How much sneezing is too much? Is the occasional sneeze okay? She has birds doing head shaking, and while nares look okay to me, when they do a violent head shake, they do seem to sometimes fling a droplet. How much scratching of their head is okay?
Yeah, that is one where I would look at that as a flock-wide issue. And this is something that I didn't get to with, there's just not enough time, but with respiratory diseases, if it's an infectious, it's going to be almost the whole group of birds. If you have one single bird in your flock that has really bad breathing, and when it breathes, you can hear it gurgle and rasp, and it sounds terrible, but everybody else is fine, that's probably an individual bird issue. And so I look at it as a flock-wide basis. If 75% of your birds are sneezing once within 5 to 10 minutes, that's a lot of sneezing. The occasional sneeze, if you see an individual bird here, an individual bird there, and it's fairly a good amount of time in between, that's normal. That's normal. When you're seeing repetitive sneezing and sneezing in a high proportion of the flock, that's when you might have a problem.
Okay, then we have from Australia. What about if you vaccinate an adult bird for MG and MS after it has recovered from the symptoms of one of these diseases? Will that stop them from getting symptoms again? They have vaccinations in Australia that you vaccinate young birds after 3 weeks of age.
Okay, that is a great question. And here in the United States, to my knowledge, there's really only one vaccine for mycoplasma that is available in some way to the general public. It is a product by Zoetis, and it's an injectable. Now, if you're going to give that vaccine after the birds have already had it, the vaccine, what it would probably do is help reduce shedding and help reduce clinical signs. And so when you have a resurgence, let's say you have a really stressful period, and mycoplasma loves stress, and it pops up during stressful times. If they're vaccinated, they're going to have less shedding, less clinical signs, less illness, less likely to die. The problem with that vaccine is, again, it's injectable. So a lot of owners aren't comfortable giving an injectable vaccine. It also needs to not be given near the point of lay, because anytime you handle birds or injecting them with things, those birds are going to get stressed and they're going to come straight out of production. So here in the US, commercial large chicken farms, they get some different mycoplasma vaccines, just as a side note.
But will it stop them from getting sick again? If you have an adult who's recovered and you vaccinate, it will reduce the likelihood, right?
Well, that's about all I can say. I can't give like a strong, percentage or, but it could get sick again, but the severity would hopefully be significantly less.
But once you've started vaccinating, you have to continue vaccinating all new birds on the farm, right? Because it's now endemic to your farm.
Right. Once it's on a property, if you were going to vaccinate, yes, it would be best to kind of continue to vaccinate everybody when they come of age. A lot of times in U.S. flocks, it can be really difficult because we now no longer have any over-the-counter antibiotics legally. A lot of people have stockpiles and different things that they use. But you have to get a script now from a veterinarian or what's called a VFD, a veterinary feed directive, in order to treat. And again, treating with antibiotics is going to help stop birds from dying. It's going to help those clinical signs, but it will never eliminate that bacteria.
Okay, is coccidiosis a young bird issue only? I was told by an avian vet that it only affects young birds, and an older bird will have some coccidiosis in their system, but not enough to cause illness.
Yeah, that's great. And what you'll find is that in general, that is true. In general, coccidiosis is a younger bird issue. And yes, if you have a mature adult bird that has a nice, strong, healthy immune system, it might have very, very low levels of coccidia in its intestines, but you will never know because its immune system is taking care of it. Now, if you have an older bird that becomes immunocompromised from something, let's say it develops another disease that makes it sick and has an inability to fight off infections, in a immunocompromised older bird, you could see those birds develop coccidiosis, even though they're older. That would be the most common scenario in which an older bird would develop coccidias if its immune system's not working.
A lot of it depends on how it was raised in the first place.
Yes.
A question about trauma from mating. Do you recommend hen saddles? She has a girl who's bald under her wings, even though the rooster is under a year and his spurs aren't that long. Will the feathers grow back? I couldn't see the spots until one day when she was preening. I accidentally saw a little bit and moved her wings.
Okay, great question. Part of the answer is, do I recommend saddles? I wouldn't say just to put them on every hen. If you have a rooster, I think it would be kind of an unwarranted expense. That being said, you do need to be attentive of your birds if you do have a male in with the hens to make sure that there's no evidence of damage to your hens. And if there is, then you might want to consider a saddle, because the problem is if the feathers break, that's okay. They're going to go through a molt and those feathers will come back the next time. The issue becomes when you get the male mounting the female and you get those spurs digging into the skin. If it scars the skin, just like if you've ever gotten a scar on your head, it's going to be bald. Hair's not going to grow back there. And so if you have chronic enough irritation or wounds from a male mounting a female, it can damage the skin to a point that the feathers won't grow back there. In which case a saddle is needed, because believe it or not, birds can also get sunburn. So having unexposed or having exposed skin on the back of a bird, they can get sunburn. So yeah.
Okay. Another thing I see often online when a bird is sick, that people always ask, when were they last wormed? I discussed this with an avian vet who said that worms are also a young bird issue only, and it is not necessary to regularly worm an adult bird. Is that your view too?
Again, that's a generalization, but yes, I would largely agree with that most of your intestinal parasites, particularly coccidiosis and roundworms, tend to be a bigger issue in young birds. Again, there are some situations in which older birds can be affected. Now, what I strongly advocate for is doing fecal exams on your flock at least twice a year. Because I'm a firm believer of why deworm or treat for worms, deworm your birds if you don't have any. And so I strongly recommend a pooled fecal sample be submitted to a diagnostic lab or to your local vet if they're willing to do chicken fecal exams twice a year and look for signs of parasitism. And if there are none or they're very mild, don't treat.
In the US, there is very limited legal dewormers available. And for an adult laying hen, there's only one. So it's, deworming regularly, you may have to throw out the eggs. So that doesn't make a lot of sense. If you rotate pastures or whatever, you're going to get rid of that too. What can be done when birds have scaly leg mites?
So scaly leg mite, there can be a number of different treatments. Some folks will use like dermal, like ivermectin, and they'll just put it on the skin, and it actually ends up kind of being like frontline for dogs or cats. It's not labeled for poultry. And by the way, I should mention that, I am neither diagnosing or giving treatment advice specifically for anything. These are generalizations. Common things that people will do for scaly leg mite is to coat the legs in either Dawn dish soap or Vaseline. It's a very easy treatment. Basically what you're doing is suffocating the mites that are buried underneath the skin. So doing that at least once a week for a number of weeks will reduce it. You can treat, again, not labeled. I'm not talking about legality, but people do treat with things like ivermectin. There's also, you've probably heard about people dipping bird legs in kerosene or gasoline for treatment of scaly leg mite. I know people that have done it. I know it to be effective. It just worries me a little bit if there's any source of flame. So don't smoke around a bird that you just dipped in its legs in gasoline. But by and large, I think if you go with a Vaseline or Dawn dish soap and just coat those legs, keep the bird in a separate area on, a towel so it doesn't get, litter stuck to its feet now that have Vaseline all over it, and just keep that treatment up, you'll take care of
it. It does take a long time for the scales to fall off though, so.
Yes. And so one of the things is that you will find clients will keep treating and treating and treating, thinking they haven't gotten rid of it. But yes, it takes months and months and months, if not sometimes a year, for those scales to go back to normal. If they do, there can be enough scarring and damage there that those scales will never potentially look normal.
That photo you showed, that's not going to go back to normal.
Yeah. No, that would not quite go back to normal.
On the vaccines that are injectable, some say you can put it in their water. It's just a little less effective. Is that true? Even asking for the meds I already have. A lot of it depends on why it's injectable.
Well, yeah, a lot of it, it's always best to give a medication by the formulation or by the route that it was intended for. For example, if you have LA200, that's an injectable. It's always going to be best to give it as an injection versus orally. And same for other things. I know a lot of time I've heard of people, deworming their birds by putting ivermectin in water. Well, that actually doesn't work that well because one's hydrophobic and one is not. And so it acts like oil and water together, and they don't mix well. So there are a lot of different reasons that giving a medication outside the way that it was intended is either can be toxic to a bird or just won't be as effective. But yes, I have heard usually, but that's where I'll go with that. In terms of vaccination, of giving an injectable vaccine in the water, largely that's not going to work. Because what the vaccine is are antigens, they're proteins, essentially, that are inducing a immune response in that bird. If you give it in the drinking water, it's just going to drink those proteins and they're going to get dissolved in the stomach acid and digested, and they're not going to have the intended effect.
Right. I mentioned in the chat that mycoplasms are endemic in many areas of the U.S. and that they're a common problem in small and backyard flocks. So somebody asked, are there certain environmental factors that let mycoplasma flourish in areas where it's endemic?
I would say not so much, yes, but in terms of husbandry. If you have birds that are in an extremely dusty barn or a very high humidity barn with ammonia, so now you've got, dust or ammonia complicating that mycoplasma, making it worse. Yes. So there are definitely things that you can do to help those birds that are sick or reduce issues with mycoplasma, like having good ventilation, having good litter moisture control, eliminating other introduction of other diseases. And again, that's the biggest thing. It's just preventing disease from getting onto your property, which is another side note. I always recommend clients, if possible, to start with chicks. Or if they're going to add birds, always add chicks. Chicks are coming directly from a hatchery, directly from the parents. They have had almost zero time to pick up disease. Whereas if you get that 2-year-old bird, that 1-year-old bird from Jim down the street that's moving and has to get rid of those birds, that's where you're in danger of picking up disease, more so than a day-old chick.
Our participant from Burkina Faso says, congratulations for your best presentation. We have learned very much. This was really amazing information. The injectable, I think that's what it is it available for small and backyard flock farmers?
Or I think is that one, they might have been referring to the only approved anhelminthic, I think is what they might be referring to, and that is Aquazol.
Yeah, that's anybody buy that.
Yeah, anybody can get that. It's from Merck. The problem is it is a one-size-fits-all bottle, and it's designed for commercial poultry. And so I think one bottle of the stuff is like $300. So
I have seen smaller ones online.
Oh, are there? Okay, all right, but it is a rather expensive medication because it's designed to treat hundreds of thousands of birds on a site. So,
can skeletal problems in chicks, especially turkeys, be corrected successfully?
It really depends on the reason for the underlying cause of the skeletal lesions and how early they're detected. The problem with baby chicks or poults or ducklings, regardless of when they first hatch, their ligaments and their tendons are very rubbery. They haven't started to really solidify yet. And that solidification happens over time. And so I have a feeling what you're referring to is probably something like splay leg, where they're born and their legs are splayed out. Their legs are splayed out to the side. The problem with that is that the longer they go before the owner has noticed that issue, the less likely that the limb is still malleable enough that you can retrain it to get back into a normal position and not be stuck out at the sides. So it depends entirely on why it happened, how early you caught it, and the extent of the treatment that you're willing to do for that bird. But yes, they can be corrected.
This is the feeding question. What do you think of fermenting feed?
I'll be honest, I haven't seen studies or anything that really have looked at health benefits. I'm sure they're out there. I'm just not familiar with them. Nutrition's not my background. That being said, I've known a ton of people that swear it makes a huge difference for their birds. And so, Dr. Jacob, if this is something that you have more experience in,
I'm
please.
a nutritionist, and it's a lot of work. You have to do it right or it becomes moldy. And basically they're just growing lactobacillus. So giving a probiotic is a lot cheaper and a lot easier than trying to ferment it and hope nothing goes wrong.
Okay, great.
People do it and swear by it, but
Yeah.
to me, it's a lot of work with the risk of mold and mycotoxins. So they also
Sure.
wanted to know if there was a healthy snack you can spoil your birds with. Anything that's high in energy is going to cause obesity.
Yeah, so the best things are probably fresh fruits and vegetables. The main thing there is, heads of cabbage are great for enrichment too. Lettuce, any greens, leafy greens are great. Carrots, things like that. The main ones that you want to look out for are those mealworms, sunflower seed. Any type of seed is usually very high in fat. Mealworms are very high in fat. Things like suet blocks, I've had people feed their backyard birds as treats. Way too high of fat. It's pure fat. So yeah, any fruits, veggies. The biggest thing is to clean up and not let uneaten food items spoil and rot in the coop area. And in general, I do not recommend feeding raw or cooked meat scraps. Again, those meat scraps are going to attract predators. Flies are going to get in those, maggots. Then you can be dealing with things like botulism. So the best thing are fruits and vegetables.
Yeah, when you're having a feather pecking problem, which can happen in any flock, hanging up a cabbage or lettuce always gives them something to peck at and stops. But we're way over time, so thank you for your presentation. They obviously loved it, had lots of good questions, which you did a great job answering. I really appreciate your time. It was nice getting to know you too, because we didn't know each other before. So
yeah, haven't met.
So thank you very much. Happy New Year. Happy New Year to everybody else. I did put the link in for how to find out about upcoming webinars and our Facebook page. So, and if you have any suggestions for more topics, feel free to let me know. I have finished the 2024 webinar series, but I can, try and get some extras in. Oh, we got a question that just came in. My title, Extension Project Manager. That's my official title. So thank you, guys. Thank you very much. And that is the
Absolutely.
The end of the webinar. I'll just answer this person's extension.
Well, thank you so much, Dr. Jacob, and thank you everybody for attending. Hopefully you learned something. I'm going to pop my email in the chat just one more time. And if you have any questions, do not hesitate to reach out. Thank you so much. And
we had people from Australia, Burkina Faso, and several states. So it was a good crowd. Thank you very much, everybody. I'm going to terminate the webinar.
Thank you.
Thank you.